Hi, my name is Janica. In this reflection, I'll share how I use the clinical judgment measurement model while caring for a patient with end-of-life needs. This experience demonstrates my achievement in the SOL number 2 and NEPLO number 2, showing how I use nursing judgment and the nursing process to provide safe, compassionate, and evidence-based care. The patient in my scenario was an older adult with metastatic cancer who was receiving hospice care at home. The goal of care was comfort, dignity, support for both patient and the family. Recognizing cues, I noticed that the patient was experiencing more frequent pain, increased shortness of breath, and appeared fatigued and anxious. The family members were worried and expressed that they felt helplessness watching their loved one decline. These were important cues that told me both patient and family needed additional support. When I analyzed the cues, I thought about what these signs meant. The worsening symptoms likely indicated that the disease was progressing and that our current pain management plan wasn't effective. The emotional distress also told me that the family did not fully understand what was going on and what to expect as the patient's condition changed. Next, I prioritized my hypothesis and focusing on the management of the patient's pain and breathing difficulties since physical comfort is essential at this stage. My secondary focus was providing emotional support and education to the family, helping them feel more confident and less afraid. I then began to generate possible solutions. I collaborated with the hospice nurse and the provider to adjust the patient's pain management, the pain management, and the pain medicine schedule. I planned comfort interventions like repositioning for easy breathing, watching TV and listening to music, and slow communication to reduce anxiety. I also prepared to spend extra time with the family to answer their questions about what to expect in the days ahead. When it was time to take action, I administered the prescribed medications, helped the patient find a more comfortable position. I encouraged slow breathing to ease discomfort. I played slow classical music that the patient liked. I also sat with the family and listened to their concerns and reassured them that what they were witnessing was a natural part of the dying process. I finally evaluated the outcomes. After medication adjustment and comfort interventions, the patient's pain and breathing improved noticeably. The family said they felt calmer and more supported, and they were better able to participate in caring for their loved one. Reflecting on this experience reminded me that nursing judgment is not just about identifying and treating symptoms, but it's also about empathy and communication. Just providing presence at the end of life care requires both clinical reason and emotional awareness. Using clinical judgment model help guide my decision making, but compassion will always connect you with the family on a deeper level. This experience and this experience strengthened my confidence in applying the nursing process and reinforcing the importance of holistic care, honoring the patient's comfort, their dignity, and their way of life at the end of their life. Thank you.